Mitral valve regurgitation, often called a leaky mitral valve, happens when the valve between the heart's upper and lower left chambers doesn't seal tightly, letting some blood flow backward.
In a healthy heart, this valve is a one-way gate. When it leaks, your heart has to work a bit harder, pumping some of the same blood twice to keep enough moving forward. Doctors grade these leaks as mild, moderate, or severe. A moderate grade means the backflow is significant, but it hasn't reached the high-risk stage where you'd need an urgent surgical fix. To figure out the grade, cardiologists use an echo to measure the size of the leak and the volume of blood slipping backward with every single beat of your heart.
It's not just about one number, though. Your doctor looks at the whole picture, including the valve's shape and the size of your heart chambers to get an accurate assessment.
The heart is pretty adaptable. It can often handle a moderate leak for a long time by gradually enlarging to manage that extra volume of recirculating blood. Because the heart compensates so well, many people with moderate leaks feel perfectly fine. That's why the main goal right now is simply monitoring to make sure things stay stable. If the leak does start to worsen, it can cause pressure to build up toward the lungs, leading to shortness of breath or rhythm issues like atrial fibrillation. It helps to know why the valve leaks. Primary MR is a structural issue with the valve itself, while secondary MR happens when the heart changes shape and pulls the valve apart. Symptoms can be very subtle and slow to appear. You might notice you're a bit more tired than usual, have less stamina, or feel a fluttering sensation in your chest. For most people with no symptoms, guidelines suggest a checkup and an echo every 1 to 2 years. This watch and trend approach helps catch any changes early.
At the moderate stage, we usually focus on observation and managing things like blood pressure. Procedures are generally only considered if the leak becomes severe or the heart shows strain.
Your cardiologist will keep a close eye on your heart's pumping strength and chamber sizes. These are the key signs that tell us if the heart is struggling with the workload. Even with a moderate leak, you should report any red flag changes right away, like new breathlessness when lying flat, sudden fainting, or a big drop in your exercise tolerance. By staying on top of your checkups, you and your medical team can manage this effectively, ensuring you get the right care only when it's truly necessary for your health.